Now I'm going to discuss a case that we had recently. I have a case of a 43-year-old female who came in and was complaining of irritable bowel, bloating, pain, distension, inability to have bowel movements. She probably had a bowel movement about once a week, if that. No matter what she ate, and she was actually a pretty healthy eater, she still would have pain and discomfort. One of the things that we found upon history and examination when we consulted with her was that she had a history of a lot of stress related to work. She traveled out of the country as well, multiple times for long periods of time. A lot of stress in her life related to work. When we did her saliva test, because we thought that was an important test to do on her because of the high stress levels that she had, and also she was concerned about her hormones too. We found that her cortisol level, which is her stress hormone, which normally should be between 22 and 46, was a whopping 206. So her cortisol levels were extremely high. So one of the things we knew was that, that obviously that there was probably damage to the gut barrier because of this high level of cortisol. And what we found was that her cortisol rhythm was that she was extremely high in the morning, all throughout the day, and even into the night. Actually, the whole time she was pretty much elevated. Then this is where her rhythm cortisol load was, and the green is where it should be, basically. So some of the things that she expressed was, inability to sleep, chronic gut issues. Was constantly alert and awake. So we found that this was one of the reasons why her cortisol level was so high. So we started doing some things with her, which we're going to talk about in the next couple slides. But after about 4 months after doing the protocol that we did with healing her gut and working on her gut infections and working on her adrenals as well, her cortisol load came down to 26. So from 206 to 26. And this is through dietary changes, supplementation. We worked on killing gut infections as well and took her off the foods that she was sensitive to. So this patient now was going from here where she couldn't sleep, she couldn't exercise. Now she was able to sleep. She has much better mood. She feels better. Her gut's functioning much better. This is just one of the tests that we did with her. The other test that we did with her, we actually found that she actually had 4 gut infections. This just represents 2. This is a different test, but she actually had 4 gut infections, we found. So she had 2 bacterial infections and 2 parasitic infections. And we know that, with that high adrenal stress, it probably, damaged her gut barrier. And when she was out of the country in Afghanistan, it's very likely that eating the foods there, because her immune system was damaged, she acquired some of these nasty gut bugs. And so despite the fact that she was a fairly healthy eater and even was vegan for a period of time, she was actually in major discomfort because of a lot of these gut infections that she had. So what we did was we used a combination of herbal products to kill the specific infection for a period of time, but we also use the Rife machine, so we're able to program it to kill off these specific infections, which she could notice almost immediate change in her symptoms that way. The other thing we did with her is that, again, she ate pretty well. She thought she ate pretty well. She really didn't eat a whole lot of grain, but the grains that she was eating was hemp. She was eating, rice. She was eating potatoes, foods that she thought were gluten-free, basically. So when we did her cross-reactivity test, unfortunately, we found that she was reacting to cow's milk, casein morphine, which is the protein in cheese. She had multiple cross-reactivities. Even foods such as corn and rice, potato, hemp, buckwheat, millet, even some of these grains that we thought, she may have thought were safe, we actually had to remove those for a period of time. So in doing that, we started to really see her body function at a much better rate. And This patient actually has an autoimmune disease along with the IBS symptoms. So she was happy to find out through doing this, not only were her symptoms 100% better, but also her endocrinologist told her she would not need to have her thyroid removed. So again, prior to this treatment, they thought they were definitely going to have to remove her thyroid. But having treated her and having worked with her, we were able to resolve the underlying causes and reestablish her health. Along with the adrenal stress test that we did, we also found that initially her cortisol load in association with her DHEA, which is the precursor to her sex hormone, was adapted with a slump. After the test, when we did the post-test after 4 months, she was in a complete normal range. So by removing a lot of the stresses to the adrenals, we're able to reestablish proper health. Along with that, we also found that initially her hormones were elevated. Her free testosterone was elevated to 39, and her estrone was 149. Post-evaluation told us that her free testosterone was in normal range, and also her estrogen was still elevated, but it had reduced by about 60 points.